I want to bring in Dr. Brandon Traxler. She's the interim director of public health at the South Carolina Department of Health and Environmental. So much for your time this morning. I know how busy you are. We just heard Dr. Walensky there say that she's presuming that this new variant has already spread within the community here in South Carolina. How much spread could we be talking about?
Well, we are seeing high numbers of cases of COVID-19 overall in South Carolina. However, I do want to emphasize that we have been doing this surveillance sequencing in our state for months now, going back to last summer, as well as working with the CDC and other labs. These are the first 2 cases of this variant that have been identified. So we will be continuing to work with the CDC to do more enhanced surveillance, further testing, to get a better idea of potentially how much there is.
The 2 individuals who presented this new strain, what can you tell me about their condition? They're doing okay?
Yes, both have done fine and have recovered.
And they're outside the period of contagiousness, is that right?
That is correct. They and their close contacts at this point are no longer contagious.
A few moments ago, we heard the White House COVID-19 response team. The response team said that vaccinating as many people as possible, as soon as possible, is key, especially with this new variant. What can South Carolina do to make that happen?
What we are doing is exactly what we need to be doing. We have increased our pipeline of providers who can give vaccines, working with our fellow agency over at the Labor Licensing and Regulation, some of the medical boards, as well as within DHEC. We have expanded the number of people who are authorized to give vaccinations. We have enrolled hundreds of providers who want to provide the vaccine as soon as we have enough flow of it coming into the state to be able to get it to them. So we are prepared, we are ready, and we are getting shots in arms. We just need to be getting more vaccine.
Dr. Traxler, your department has also said there's no evidence this South African variant is deadlier. Existing vaccines could still offer some protection against it. If that's the case, how worried should folks really be?
Folks need to remain diligent. They need to use this as a reminder of how important it is to do those small things that mean big differences. Wearing a mask, doing the physical distancing, hand hygiene, avoiding large crowds or group gatherings when possible. And then, of course, when it is their turn and it is available to them, getting vaccinated. As you noted, that is going to be a key part of preventing the spread of COVID-19, of all the versions of it.
Before I let you go, let's talk schools for a moment here. There seems to be growing consensus that kids might actually be relatively safe going back to in-person class as long as they take safety precautions. We just heard that from the new head of the CDC. The CDC said so. Dr. Fauci said so. Even the Medical University of South Carolina, not far from where I'm standing, said so. The university's research found just 1% of the students and staff in Charleston County Public Schools tested positive for COVID-19 between the start of in-person school in early September and winter break. I'm curious how much you share their optimism, especially in light of this new variant.
I do share their optimism. We have seen that these school districts and schools are really putting those protective mechanisms into place, encouraging masking and so forth. And we have not seen evidence of a large amount of spread of the virus within the schools, within the classrooms. So it can be done safely.
Dr. Brandon Traxler. Dr. Traxler, thanks so much for your time. Good luck to you, okay?
Thank you, sir.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.